The Karl Heusner Memorial Hospital is Belize's busiest public medical facility. As the country's national referral hospital, the most difficult cases from around the country are sent to the specialists of the KHMH.
The majority of people in Belize don't have the option of going to private tertiary care or to go abroad for specialist care. It's prohibitively expensive for most people in Belize, as we are not a rich country. So that enhances the need for a hospital such as the Karl Heusner. It has to perform optimally. It has to grow and evolve to meet the needs of the country as those needs change.
And nowhere are those growing needs more obvious than within the pediatric ward of the KHMH. The pediatric ward is currently designed to treat 25 patients between newborn to age 13.
Good morning. Good morning. How's the baby?
But according to the doctors and nurses, children admitted in critical condition are often at a distinct disadvantage.
At present, we have one room where that is always prepared for an emergency. But if we have two or three children with who is critically ill or who are critically ill, then we have to shift around other patients to accommodate that child in one room. Make different arrangements, borrow equipment from the other unit if they are not in use.
You have to understand that we're starting from zero. We don't have a PICU. These rooms are used for intensive care when necessary, but they're far from ideal. Many of the walls have deteriorated, sometimes water damage from the windows. We keep trying to get new equipment as required, but there's never quite enough. So some of the equipment we use is quite old, going back almost to the inception of the hospital, almost 12 years ago.
During one of her many visits to the hospital, Special Envoy for Women and Children, Simplis Barrow, immediately saw the need for a PICU. In consultation with doctors, nurses, and staff, Mrs. Barrow proceeded with a plan to construct the much-needed Paediatric Intensive Care Unit. Ground was broken for the project in June 2011, with construction to commence as soon as possible.
It's critical to customize the space and put in the technology that you need so that it's close at hand, so that when you do have to respond, everything is there that you need for a proper response.
For the doctors and nurses, the creation of a pediatric intensive care unit would also change the public's perception about the standard of care being delivered at the KHMH. According to the medical staff, parents are often confused about the condition of their children because critical cases are in the same ward as patients with broken bones or minor infections.
Whenever children get very ill, it creates huge amount of concern among family, friends, not to mention the staff at KHMH, because we understand the value of a child. I think that's basically the lesson. We understand the value of a child and the potential that children have.
Barrow also understands the value of children and for years has worked hand in hand with the KHMH to give Belizean children the best start in life.
I think it's important that we look at our children and we afford them the opportunities that they deserve, because children are our future, but they're also our present.
To have a major sponsor like Mrs. Barrow and her organization, I mean that takes away half the concern and the worry about how we're going to do this. So if we can get this off the ground as we plan to, it will be a big boost for the hospital, and it's a very essential service for the hospital.
Establishing an additional unit will mean procuring new equipment and recruiting specialized doctors and nurses, which is a major concern for parents.
More staffing, because when the nurses has to be with the more critical patient, then we are left here waiting, and then they have a scheduled time when the child should get their medication. And if my child is not getting his medication on time because they're dealing with the critical case, then we need more staffing.
it's been a learning experience for both myself, health-wise and otherwise. And if there's a possibility that funding could be available where they can expand, it would be much better.
The administration of the KHMH is counting on the support of local and international funding partners to bridge the financing gaps.
We need monitors, we need ventilators, we need incubators, warmers as we call some of them, lamps, pumps, infusion pumps for medication. The list is probably a comprehensive list, I would have to say. We need just about everything related to intensive care. You need the human resource, but you need the technology. ICU medicine is high-tech medicine. If we don't take care of our children, it says a lot about our society and about the people that we are.
Say bye-bye. Bye.
Please help the Karl Heusner Memorial Hospital give Belizean children a chance to realize their potential. Contact the Office of the Wife of the Prime Minister today. Your support will save lives, empower a people, and build a nation.